If you have ever wondered who saves an astronaut on Mars, the uncomfortable answer is not Earth. At least not at first. NASA can train the crew. It can build procedures. It can model emergencies before launch. It can send advice across deep space. But distance changes the first minutes of a crisis. By the time a full answer comes back from Earth, the crew may already have made the decision that matters. The first serious medical emergency on Mars will not wait for Earth. Earth cannot help fast enough. That is the rule that changes everything. Imagine an astronaut coming back from a surface task. The suit is dusty. The habitat airlock cycles. The crew expects a normal debrief. Instead, the astronaut reports chest pain, dizziness, and shortness of breath. Nobody knows yet what it is. Dehydration, suit stress, panic, a heart rhythm problem, a lung problem, infection, something simple, something dangerous. The habitat is stable, but the person is not. The medical kit opens. The commander starts the emergency protocol. One crew member watches the patient. Another checks the habitat. Someone sends the first message to Earth. Then the delay becomes real. The crew cannot pause the first 10 minutes and wait for the perfect answer. They have to decide what measurements matter first, what treatment is safe, who keeps the habitat running, who watches the patient, whether the outside work stops immediately, whether the problem could threaten anyone else. That is the Mars emergency, not screaming. Triage. Step 1, protect the patient. Step 2, protect the habitat. Step 3, protect the mission from making the medical problem worse. Step 4, prepare the message for Earth, knowing the reply belongs to the next phase, not the first one. On the International Space Station, an emergency is still connected to a powerful support system. Mission control can talk in real time. Doctors can advise. Cargo vehicles can bring supplies. In extreme cases, return to Earth can be part of the plan. Mars breaks that model. Not because NASA stops helping, because distance changes what help means. NASA groups distance from Earth as one of the major hazards of human spaceflight. The farther astronauts go, the harder it becomes to receive instructions, supplies, medical care, and other support from home. For Mars, NASA describes communication delay that can reach about 20 minutes one way. That means a question and an answer can take far longer than the first emergency decision. That is not a minor inconvenience. That is the end of real-time medicine. If a crew member collapses in a Mars habitat, a doctor on Earth can help later. But the first assessment, first choice, first treatment, and first mistake belong to the crew. That is why this is not really a story about one injury. It is a story about authority. Who decides when Earth cannot answer quickly enough? The commander? The doctor? The healthiest crew member? The whole group? The protocol? The onboard computer? The flight rules written years earlier? Every answer has consequences. Now imagine the medical problem does not happen on a quiet day. Imagine a habitat alarm during a surface mission. One astronaut is short of breath. Another is still outside. Dust has reduced visibility. A filter needs attention. The medical kit is open. A message has been sent to Earth, but the reply cannot arrive in time to make the first decision. The crew has data, training, and procedures, but no rescue. That is the Mars difference. A minor medical problem can become operational because the crew is small. If one person becomes the patient, the working crew is smaller. If the crew doctor is the patient, the problem becomes worse. If the emergency happens during maintenance, the mission may have to choose between a person and a system. This is where space medicine stops sounding like medicine and starts sounding like command. What gets delayed? What gets canceled? What risk is accepted? What if treatment uses supplies that may be needed later? What if the right decision for the patient creates a new risk for the mission? These are not comfortable questions, but a Mars mission has to carry the answers before launch. No overnight hospital. No evacuation helicopter. No new specialist. No spare crew. No emergency shipment. no instant family call that works like Earth. The habitat is the clinic. The crew is the response team. The mission is the waiting room. That does not mean NASA is unprepared. It means preparation has to move forward into the spacecraft. Crews need medical training. They need diagnostic tools. They need procedures that can be used under stress. They need pharmacy planning. They need ways to handle pain, infection, injury, behavior, sleep loss, and uncertainty without turning every problem into a mission-ending event. The most important medical tool on Mars may not be one device. It may be a decision system. Because the hardest part of an emergency is not always knowing something is wrong. It is knowing what to do while the clock is moving and the people who could help are millions of miles away. Mars also creates ethical pressure. On Earth, a serious medical emergency can trigger a chain of institutions. Ambulance, emergency room, specialists, surgery, intensive care, records, law, family, and backup teams. On Mars, that chain is compressed into a handful of people inside a habitat. That is a lonely form of responsibility. It is also one of the reasons Mars is much harder than the Moon. The Moon is dangerous, but it is still close enough for a different kind of support. Mars forces the crew to become Earth-independent for longer, under more uncertainty, with less room for outside intervention. This is the first Mars emergency Earth cannot fix quickly. Not because Earth is unwilling, because Earth is late. The delay means the crew has to act first and explain later. The distance means evacuation is not a realistic immediate option. The closed environment means the emergency can affect everyone. The limited supplies mean every treatment has a cost. The small crew means every sick person is also a missing worker. On Mars, a medical emergency is never only medical. It touches operations, psychology, ethics, logistics, and survival. The public version of Mars imagines a first footprint. The operational version has to imagine the first fever, the first fracture, the first infection, the first panic attack, the first allergic reaction, the first failed procedure, the first moment when the crew realizes Earth cannot answer fast enough. That is when Mars becomes real. Not when humans arrive. When something goes wrong, and the only people close enough to respond are already inside the problem. Mars makes ordinary emergencies strange. A fever on Earth means a clinic. A fever on Mars means contamination questions, work limits, medication choices, crew exposure, and whether the sick astronaut can still perform duties. A broken wrist on Earth means imaging, specialists, casts, and pain control. On Mars, it also means suit operations, habitat maintenance, and workload redistribution. Every human problem becomes a systems problem. That is the central line. Every human problem becomes a systems problem. This is why medical autonomy has to be designed before launch. The crew needs more than supplies. They need triage logic, diagnostic tools, imaging capability where appropriate, surgical boundaries, behavioral health support, and training that survives stress. But autonomy is not magic. It creates its own burden. The crew has to use the tools correctly. They have to decide when to trust a machine, when to wait for Earth, and when waiting is the dangerous choice. They have to protect the patient without sacrificing the habitat. They have to protect the mission without forgetting the person. That is why the topic has emotional power. Mars exploration is usually sold as courage against the environment. This is courage inside the crew. The hardest decision may not be stepping outside. It may be deciding what to do for a crewmate when every option is incomplete. The safer ending is not that NASA is powerless. NASA's preparation exists to prevent exactly that. The more serious ending is that Mars forces NASA to move the first layer of rescue into the crew itself. The first responder is not Earth. The first responder is whoever is standing in the habitat when the alarm begins. That is when the dream of Mars becomes operational reality. Not the flag, not the first photograph, the first time the crew has to save itself. without waiting for home.